Hey all, my name is Tommy and I will speak about the role of attentional focus with reference to athletes rehabilitating after anterior cruciate surgery, ACL reconstruction. The objective is to discuss contemporary practice rehabilitating ACL patients in light of skill acquisition. Firstly, I will give a brief background of topical issues in rehab process in general, and then I will offer some potential solutions from SNC perspective, how to counteract those problems. In general, sport rehabilitation is a treatment or training focused on regaining bodily function and repair. Previously, training wasn't part of the process as belief of self-correction was dominating the routine. It's fair to say that changing the concept and practice of rehabilitation is, however, difficult. Medical and other health personnel often feel annoyed and provoked by the critique of the traditional rehabilitation concept, arguing that such a wide rehabilitation concept is ideological nonsense with no roots in scientific knowledge, and might be also they see themselves as rehabilitation specialists. However, in last decades, historical shift occurred where from this traditional biomedical view of mainly self-correction and repair, emphasis is on patient active participation and multidisciplinary team approach. Part of that multi-profession practice, the role has a strength and conditioning field through repeating physical activities for the purpose to improve performance, and as well as a central activity for learning. Importance of training was recognized especially in ACL pathologies, where SNC coach has been considered as standard team member. Components of current rehabilitation programs entail a combination of exercises to increase muscle strength and endurance and improve neuromuscular function. However, there is no validated rehabilitation program that addresses not only the residual neuromuscular impairments following ACL injury and reconstruction, but also the known risk factors for second ACL injury. It's quite paradoxical, but ACL surgery is considered to be a successful procedure as it results in return to pre-injury activity levels for the majority of patients. But it has been also reported that deficits in function, muscle strength, neuromuscular response, kinematics and kinetics persist even after a successful return to sports. Typically, ACL injury prevention programs entail a combination of plyometrics, strength training, agility and balance exercises, but unfortunately improvements of movement patterns are not sustained over the time. And this is in line with one of the reported injury risk, which is changes in biomechanical characteristics during dynamic tasks. What evidence report is that often athletes have undergone ACL reconstruction and been cleared to return to activity. Deficits in neuromuscular control are still evident. Evidence is showing that recovering strength is important criteria during rehab process and also predictive factor of future complications. Therefore, lifting a weighted apparatus is global activity of rehab. However, it cannot be considered as a single important factor to success of rehabilitation. As an example, Hernana with colleagues has demonstrated that improvements in maximal voluntary isometric contraction strength are not translated to enhancement in biomechanical parameters, and in that regard, the introduction of at-risk techniques awareness, technique modification with appropriate motor learning strategies might play a key role, especially when trying to overcome reported programs' effectiveness lack in long term. In other words, it might be that traditional rehab is heavily relying on recovery of normal strength symmetries after ACL reconstruction, but unfortunately might not be a straightforward warranty to appropriate neuromuscular function. So in next slides, I will present some of potential solutions to that problem from SNC perspective, particularly with reference to skill acquisition. In motor learning theory, the attentional focus emphasized in verbal instruction influence movement and muscle recruitment characteristics. What do athletes pay attention to when executing a complex sensor motor act might have significant impact to performance. Nothing different is in rehab situation. Practitioners have different options how to direct players' attention toward desired order, form, or timing of various limb movements. Notably, evidence shows that focusing athletes to their own movement, described as internal focus, is a predominant strategy. Coaches instruct patients in 85% with internal focus of attention, and this is even more pronounced observing physiotherapists. They use internally oriented focus in 95%. So instructions such as keep your knee over the toe during a squat exercise is an example of prevalent communication tactic. However, it's questionable if such a tactic to allocate athletes' mental resources is appropriate. In regards to stress and fatigue, it has been proposed that these two are contributor to ACL injuries, as reducing capacity to control body movement might be limited. It has been shown that stability of the skill depends on the level of mastery. Skill acquisition theory suggests that novices are paying much higher degree of attention to more component stages of motor act, referred to declarative or cognitive stage, while experts' attention is less occupied with skill performance, referred to procedural autonomous stage. This is in line with theory of Masters, who argues that when under pressure, performers reinvest the declarative knowledge acquired during the early stages of skill acquisition, which is leading to a disruption of procedural knowledge. This is known as reinvestment hypothesis. The interesting prediction from this theory is that training under the high degree of self-consciousness and skill focus should lead to the development of a large amount of explicit declarative knowledge that will increase the likelihood that performance will fail when under pressure. In support of this prediction, Lyo and Masters demonstrate that self-focused training, for example, of basketball free throw shooting, led to a greater amount of explicit knowledge and worse performance under pressure. In that regard, importantly, evidence is reporting that athletes in general tend to adopt internally directed focus of attention, which is emphasized even more in ACL athletes. ACL athletes naturally tend to adopt internally oriented focus as instinctively taking care about their injured site during performance, and this might automatically develop high degree of explicit movement monitoring. This is what could be observed working with ACL athletes. They are extremely worried or busy about their knees, and this protection is high even in very controlled movement, such as knee extension in the stages when their knees are already structurally healed. On the other side, the real sport pressure will increase self-consciousness and performance and anxiety even more, causing the athlete to take conscious control over a proceduralized skill. In that regard, coaches' behavior might be crucial. Coaches pressing athletes thinking too much might trigger subnormal performance. This observation suggests that there might be an inverse relationship between the current level of performance and the amount of skill-focused attention. One of the risks for injury or injury are sharp and aggressive movements such as act of jumping. Makaruk and colleagues in their study compared impact of different focus of attention to different jumping styles. In 9 weeks long study, they have shown that an external focused group resulted in greater increase in motor skill performance and safer landing. And this greater knee flexion displayed by the externally oriented focused group might demonstrate a more effective coordination pattern, which allowed the external focused group to produce greater muscle contraction during the concentric phase of the movement as more time to develop propulsion was available. This kinematical adaptation, more knee flexion ACL patient might be considered as protective through less stress to ACL relative to more extended knee joint. But what is interesting is that kinematical changes were recorded only on the standing long jump and the counter movement jump, but not on the drop jump. In drop jump, external focus orientated group increased contact time, but with no angular changes. Means that they adopted a softer landing strategy. In part, this might be explained by previously mentioned reinvestment theory, In particular, plyometric training should reduce contact time. Thus, the increased contact time demonstrated by the externally focused group during the drop jump might be an indication of increased cognitive load brought on by complexity of the drop jump task. In that regard, longer contact time might decrease peak forces applied to the knee joint, playing a preventive role. However, this is not favoring muscle stiffness that was increased for internally focused group. Another study demonstrating the role of attentional direction was conducted by Gokelar and colleagues. The influence were directing attention during rehabilitation of patients after ACL reconstruction was observed in single leg jump hop. Home tests in general are commonly used to quantify knee function to determine safer return to play. In particular, single leg hop jump can evaluate combination of muscle strength, neuromuscular control, confidence of the limb, and ability to tolerate loads in sport-specific situations. What they demonstrate is that external focus group had significantly greater knee flexion angles at initial contact, greater peak knee flexion, total range of motion, and time to peak knee flexion for the injured leg. So the result illustrates external focus of attention as superior strategy to enhance safer movement patterns compared to an internal focus of attention, and subsequently may help to reduce second ACL injury risk. In next study, Laufer and colleagues investigate the effect of attention direction to dynamic balance, in particular with reference to the stability of learned skills after cessation of exercise. Despite subjects were not ACL patient, but the one recovering after ankle sprain, it's a relevant study to portray impact of attentional focus to regaining a postural control that is an important training goal following ACL injury also. This investigation revealed that dynamic balance recovery and its retention was superior in the group of athletes instructed during the practice phase with externally oriented focus. This is consistent with some other studies investigating variety of sporting tasks. While research strongly supports that manipulation of attentional focus is having impact to before described behavioral outcomes, underlying neural mechanisms are less well established. As an example, typical neuromuscular impairment such as quadriceps weakness and activation deficit that was observed in some cases more than 2 years after ACL reconstruction might have multifaceted causes. As mentioned, traditional rehabilitation might favor utilization of exercises to increase muscle size, such as concentric strengthening, while targeting neural impairments is often overlooked. But evidence suggests that neural alternations might explain almost 50% of the variance associated with quadriceps strength, where underlying mechanism to quadriceps impairments may be influenced by reduced corticospinal excitability shown by transcranial magnetic stimulation, then by altered efferent information from the injured joint, resulting in altered efferent drive to the muscle, and finally by changes in the excitability of the corticospinal tract that also can occur after ACL injury. In that regard, alternations in neural excitability are likely responsible for reductions in quadriceps voluntary activation, and maybe due to specific alternations in intracortical inhibition and facilitation. Therefore, targeting that affected neural excitability pathways might be a key step in rehab to improve voluntary muscle activation. Based on that, it's likely that approach how to coach our athletes might play a fundamental role. Kuhn and co-authors described that adopting an external focus probably contributes to modulation of intracortical inhibitory circuits and to an enhanced motor efficiency. As evidence of those neural underlying factors is less known, its degree of speculation that same neural factors might be responsible for changes observed in EMG activities of musculature. However, there is a sound evidence that important characteristics when applying external focus relative to internal focus is performance increase, while EMG activity of agonist or antagonist is decreased, lowered. Next to that more economical motor behavior, another side effect is quality of proficiency of the movement also. It's well established that co-contraction is a pattern observed in early stages of learning that go along with reduced movement variability. In that regard, overcoming reported gait variability decrease in ACL deficient knees, external focus might be an anti-freeze tactic, potentially optimizing amount of variability, which provides the human body with flexibility, adaptability, and the capacity to respond to unpredictable stimuli and stresses and environmental demands. So that's all, folks. To wrap up, firstly, verbal instructions have a direct effect on motor performance and therefore influence the risk for sustaining an ACL injury. Clinicians and coaches should therefore keep the consequences of their instructions in mind when instructing an athlete. Secondly, directing instructions externally to the effect of the movement is considered a superior strategy. However, internal focus still can play the role if, for example, co-contraction is desired outcome or explicit limit in joint range in earlier stages of rehab. Next, their injury might be a result of inadequate coaching, as practitioners might view motor learning as too theoretically driven. As an example, athletes in ball sports having to pay attention to the lower extremity is impossible, as attention to the game, players and ball and fast acting is required. Re-injuries might be a result of inadequate discharge criteria. Usually prescribed lab test might not be sensible enough to discriminate neural alternations, such as changes in primary motor cortex. Therefore, addressing those sites through the rehab might be the key. Thank you very much for listening. Stay home, stay safe, stay healthy, whatever you do.